Nearly 100 COVID-19 patients at University Hospital are participating right now in a study that looks at the effectiveness of the drug Remdesivir. Now, that drug has reduced recovery time in some patients by 30% and was given emergency use by approval by the FDA earlier in the year. Emily Olson is live. Emily, the good news is the drug shows promise. The bad news, I think it's bad news, or we don't have enough of it. Is that right?
Yep, that is right, David. At least not for now, but the drug is only being distributed to areas that need it most. So Remdesivir is an antiviral medication which was made available under the emergency use authorization. And in this study, the drug has not only decreased recovery time, but it's also reduced symptoms. Now researchers are looking to see if it's also effective with an anti-inflammatory drug. However, the government agreed to distribute Remdesivir only to communities where there was a great need, while the maker of the drug is applying for regular approval. We talked to Dr. Thomas Patterson, who's leading this study. He says the drug will most likely be made available to the general public eventually, but must be given by vein. So in other words, it'll only be given to hospitalized patients. Patterson also says 96 patients at University Hospital are participating in the research, which is a huge contribution to the study.
Many of these patients are persons of color, many Hispanics in the region. And so I think that's a major contribution, whereas many trials don't include vulnerable populations in their numbers of enrollment.
Now, follow-up with patients will last through the end of the month, and then researchers will know the results. Reporting live, I'm Emily Olson. Back to you, David.